I think the whole world has been dealing with this challenge for more than a year now, and we've watched how there's been a surge in cases all over the world, and different countries have dealt with it differently. The approach in the UAE and in Dubai in particular has always been underpinned really by science. It's science-informed common sense, and it's also been underpinned by an approach trying to balance really between saving lives and saving livelihoods. So there's been very strict protocols when the economy started opening up last summer. We've been following the numbers very carefully. We were very concerned with the rise in numbers and the emergence of new variants now about 2 months ago. And measures were in place to face the anticipated surge. And that did actually take place. So the numbers have surged, but the health system has managed to keep up with the numbers, taking care of the sick. And there's been more restrictions now in terms of activities in the Emirate and in the UAE in response to that. The approach is always really to try to balance things. The remedy cannot be worse than the ailment, and the community is responsible. We've all seen some of the news media reports about some incidents, but in science, anecdotes that doesn't make for evidence, and the evidence on the ground is that yes, there's been a surge in numbers, but the Emirate has been able to manage that surge, and the health system has been managed to maintain capacity and surge capacity.
So just so that we're clear, the data does not show, at least so far, that Dubai has been some kind of super spreader in allowing tourists to come in and out over the last couple of months. Because we know hundreds of thousands of people have come in and out, obviously, via Dubai and headed back to the UK and elsewhere.
It's not, the world today is more interconnected than it's ever been. We've seen variants emerge from different countries in the world, and these variants have been reported now in more than 70 different countries. So we're watching that emerging evidence very carefully, and I don't think it's helpful to identify a particular country as a particular source for a certain variant. I think it's a global challenge.
Dr. Alawi, I understand that hospital capacity rates are at a federal level, but could you update us on hospital capacity rates here in Dubai? And is there any credibility to reports of a shortage of beds here?
So far, the health system here in Dubai has been able to stay ahead of the curve with a surge in capacity for regular hospital beds and as well as beds that require intensive care. So ICU beds, high dependency unit beds across the Emirate. The Emirate have surged capacity ahead of the numbers, and every patient who needs a hospital bed is able to get it today in Dubai, and those plans remain ahead of the curve. So we're watching the numbers very carefully, and we're planning for even if the numbers increase further, the health system will be able to take care of every patient who requires a hospital bed, who requires an ICU bed, or God forbid, who requires ventilation. Because of the capacity to surge healthcare very rapidly in a very agile fashion, our recovery rates remain one of the highest in the world. So our recovery rate for COVID remains upwards of 99.5, 99.7%.
And Dr. Alawi, we know Dubai has taken a very unique approach here. As Hadley pointed out, it's faced international criticism for that approach. But what is the exit strategy here? And will authorities, or should authorities, perhaps start to ease restrictions once we see the vaccination rate here in the UAE moving beyond 50%?
I think the guiding principles remain the same. It is science-informed common sense. It's a balance between lives and livelihoods. It's watching the evidence and being agile and changing protocols as new evidence emerges. And now we have new tools. Now we have vaccines in place, and the UAE and Dubai has been one of the first countries to start vaccinating people against COVID-19. We currently have 3 different vaccines available for people in Dubai. with great access, with more than 120 access points for vaccines, including home vaccinations for the elderly who cannot make it to the vaccination centers. And we hope to get even more vaccines available to the citizens and residents of the UAE and Dubai.
I think you're already getting a call on this one, Dr. Alawi, but before we let you go, I want to ask you about just specifically to sort of speak to what we've heard from the international press on this one, because there's been a lot of criticism, as we talked about, for Dubai. This has been part of the strategy that the cure can't be worse than the actual coronavirus at this point. In terms of staying open, is this spike that we're seeing just the cost of doing business at this point?
I think the spike that we're seeing worldwide is probably a combination of a change in people behavior and a change in virus behavior. Some segments of society have relaxed a little bit. That's where the new restrictions and the new emphasis on precautions were important to remind people that we're not done with this yet. And there's also the issue of change in virus behavior with the new variants, which we're watching very carefully. The vaccinations are our exit strategy, and keeping the guiding principles that have kept Dubai and the UAE ahead of this curve from the beginning of the pandemic.